I'll make another, welcome to another riveting YouTube video of me talking. Has anybody actually watched them yet?
No, I like
No. Like my nose.
I'm just saying like a video.
No, that's okay. Yeah. I don't blame her. Tell her to be quiet. I mean, she should say that to me, not your daughter, or not your granddaughter. Okay, musculoskeletal system, so providing a framework for the body. So very overarching kind of deal here. It allows the body to move. So there's a lot of other things you need for it to move, like muscles for one. But without the skeletal system, there would be nothing to give it that framework and shape. There's a more comprehensive list here of functions. So there are 6 things here. So providing shape, support, and framework for your body. Protection for internal organs. So we'll talk a little about the different types of bones and what they do in the different areas in a minute. So different ones protect in different ways. Storage place for calcium and phosphorus. So calcium is something we need in our bloodstream. So if we're getting lots of it, our body can store it as part of our bone makeup. If we're not getting enough, our body breaks down some of our bones to put it back into our blood system. So for example, you can actually have heart issues if you have low calcium in your blood. So it can cause your heart muscle to be erratic and not pump effectively if you don't have enough blood calcium. So some of it is stored in our bones, so our bones can give it off for us if we need it. Plays an important role in formation of blood cells. So we'll talk more about that in the immune system. Bone marrow, so located inside a lot of the longer bones. That's where it's going to be making some blood cells for us.
What did you say that P stood for?
Phosphorus. So they're both minerals. So our bodies store those minerals in our bones for us. Provide area for muscle attachment. So if we just had muscles all by themselves, they would just contract and flop around inside and do nothing. It's because our muscles are attached to our bones that it can create movement. Okay? So our muscles are actually attaching to our bones, which moves around our framework, making movement. Right, that's why a hermit crab needs a shell. It has an exoskeleton, right? It has its skeleton on the outside, whereas ours is on the inside, thankfully. So 4 types of bones: long bones, short bones, flat bones, and irregular bones. So there's 4 more slides about these 4 types of bones. So long bones, a good rule of thumb is they're generally longer than they are wide. So can you see any here that would be considered long bones? Your femur, yes. So that's a very common long bone here. And I will tell you right now that your textbook is wrong about short bones. So that's a long bone. And all of these finger bones, are they longer than they are wide? Yes, they're all long bones. Your textbook says they're short bones, but they're not. You can Google that anywhere and look it up anywhere. Fingers are still long bones. Same as these bones in your feet here and your toes, are they longer than they are wide? Yes, those are long bones. So even though they're short, they're a lot shorter than the femur, right? These are still long bones. So your textbook actually includes these bones as short bones, which they are not. Yep, so these 2 are also long bones. These 2 in your lower leg, fibula and tibia. Yep. Radial and ulna. Those are these 2 bones right here. Those are also long bones. Yep. And that's where the long bones are where a lot of your bone marrow is going to be found, because they have that nice hollow center that has a place for the bone marrow to create blood cells inside of them. it's talking more about these ones.
Oh, okay.
Yeah. These are the ones that bear the weight of your body here. It's just an example.
If you're doing push-ups, control the military ones,
Yep.
would be
Or we,
muscle and bone would have to.
yes, and we also talked about falls and how our muscles and bones in our arms are protective against that when we have weakened arm muscles and stuff. All right, so short bones. So if your book is wrong about short bones, what are short bones? So those are kind of supportive, and they're found in your wrist. So this skeleton kind of mixes these up a little bit, but your wrist and in your ankle. So these little short bones that are more cube-shaped here, see these cube-shaped ones in his foot? Those are short bones. These ankle bones here and these wrist bones. So again, there's another slide about that. Flat bones. Where do you see flat bones here? The hip bones, the ribs, yes, those are flat bones. Your hip bones are flat bones. And one more. Your skull, all of these bones up here are flat bones. And irregular bones. So in body mechanics, we talked about these, and the major ones are right here. So they call them those mainly because they don't fit into another category. They're not really flat, they're not short, they're not long. They're this funny shaped ones along your vertebrae. So they're just irregular bones, but they do protect your spine. Right? Okay. So long bones, you guys, there's arm bones. We all talked about these. Your legs, toes, and fingers. A flat bone, yeah. Short bones, wrists and ankles. So they're like these names, no. In your worksheet, I gave you some basic ones. So the cranium, even though the skull is made up of like a lot of different bones, just know the cranium. Vertebrae, a lot of them you're already going to know. Ribs, pelvis, the ones that I would like for you to know the names of the bones in the arm and the legs, but we'll get there. Not all of the toes and the ankles, don't worry about all of those. Yeah, they call them the carpal bones. Yeah, yeah. And it's an inflammation, carpal tunnel syndrome. It is. So flat bones. Oh yes, we forgot these flat bones back here. You know what these are? Your shoulder blades. Yeah. And so they're mainly protecting things, flat bones. They're irregular ones, so vertebrae, sacrum, and coccyx. All right, here's the quiz. How many bones in the human body? 206. What do our... Yes? It left you? Yes. That's a myth, actually. Men and women have the same number of ribs. Yeah, so if you're Christian and you've been using that as an argument, you shouldn't anymore. And what does that stand for? Like what? Oh, okay. Oh, I see. That's cool. Yeah, no, men and women have the same number of ribs. Okay, what do our bones store for us? Calcium, phosphorus, which are minerals, right? True or false, a skull is made of long bones that protect our brain. What is it made out of? Flat bones that protect our brain. Good. True or false, our fingers are considered short bones. Even though our textbook tells us they're short bones, they are not. And you guys can go confirm that if you want somewhere. It's not just me making stuff up. I looked for an address, actually. I'm like, how can you guys put this here? Yes, well, I've told you guys right now that these are not short bones, so now you know. So short bones are actually located in our wrists and ankles and are more cube-shaped. Finger bones are longer than they are wide, and so considered long bones, even though they're kind of short. Okay, which of the following is not a function of our skeletal system? Circulates blood around our bodies. That's correct. Bones do not circulate blood around our bodies. Although if it's connected to muscles, muscles help in that. They can help, but it's not primarily responsible for it. You're right. All the rest, all the other 6 are the functions that I've listed for our skeletal system. D circulates blood around our bodies. Good. So structure of a long bone. So here's some new terms that might give you headaches. But in your worksheet, I have you labeling them and stuff, so you'll have some practice with using them. So long bone, whenever you see like something that's labeled, they're generally going to label one of these because a long bone has pretty much all of the structures. So, for example, bone marrow you are not going to find in flat bones, but you will find them here. They have the hollow center. Diaphysis is the shaft, so this is actually from here to here. So if you cut off the ends, just the shaft center of the bone. Yeah. Okay. The epiphysis, those are the ends of the bone. So this diaphysis, the shaft, is like a really hard, calcified kind of bone. The ends look a little more spongy. They're not spongy as in soft, but if you were to cut it open, it looks a little more hollow, kind of like, what are those, crunchy bars, like a crunchy bar. Yeah, so lots of little holes in the ends. No, the diaphysis, the shaft, has bone marrow in it. Yellow bone marrow and red bone marrow. So when you're thinking about bone marrow mainly, you're going to find it in the center. In fact, if you've like broken open a bone, like with cows, some people like suck the marrow out of it, so they eat it. Yeah, if they're sucking on bones, they're taking that out. Or your dogs like to eat that. It's a good source of, yes. The ends have a different kind of marrow in them. We're not really gonna, don't worry too much about that. Just know that the center of the bones is where you're gonna find bone marrow. But there's 2 different kinds of marrow there. So cartilage. So the ends of the bones, generally this poor guy doesn't have any cartilage, but the ends of the bones have kind of this covering, and it functions as a bit of a cushion. You would. Yeah, so some of the, exactly, so some of the illnesses we'll look at involve these joints, and we'll talk more about the joints too, but one of the things that cushions and prevents bones and things from rubbing against each other is this cartilage. And it's just that, yes, we'll talk more about that too. Yep. So to start, it's that cartilage, which is like a thin cushioning covering over the ends of the bones. Periosteum, perosteum, they do, yeah. So it's a membrane that covers the whole bone except for right where the joint surface is. So it's kind of like a thin membrane that goes all over the long bone. And you'll find a lot of blood vessels going through it. So it's part of what helps bring nutrients and oxygen to the cells in the bone. So it's just a thin covering that covers it. So I put arrows for the ones you can pay attention to. The others are just for this diagram. Okay, so the epiphysis, the end, and you can see how it looks kind of spongy. Again, it's not spongy. You can't like squish it or anything, but it looks kind of like bubbly almost on the inside. An arrow bar. It's not thicker and stronger. No, it's bigger. It's bigger. But it's mostly because there's different kinds of bone marrow in there, and the ends, those are the last part to grow, and they're a little bit bigger because that's where the joint is. So it's just a different kind of bone. Whereas along the diaphysis, it's very hard and compact. It's not bubbly at all here. It's very similar. So I'm pretty much only going to label the long bone. There is one for a flat bone, but the long bone's what has everything. Probably, yeah. All right, so you can see the bone marrow in the inside there, the periostinum, epiphysis, the ends, and the cartilage. So this cartilage shows it as this blue cushioning up here on the end. And flat bone. So this same kind of spongy bone is in the center and the compact bone there. So you don't see places for bone marrow. You don't have cartilage. You don't have a lot of the other things that a long bone has. You just have that spongy bone with that really hard stuff on either side. So their function is really just mainly protection. It doesn't do other things like making blood cells, that kind of thing like the long bones do. And again, those flat bones are like your ribs, your shoulder blades, your skull, your pelvis. Yes. It doesn't have some of the other functions like the long bones have. No, not necessarily. They still have, like, really to heal themselves, they really just need good blood flow around them. Yeah. The other functions, like, yes. So one of the reasons ribs take so long is because you're moving them all the time. It's really hard to splint them and support a rib fracture. Yeah, you're always breathing, you're always moving, so that's one of the reasons why. They are a bit thinner, so they could be easier to crack than the bigger ones. But again, not all long bones are big. If you've stubbed your toe and broken a toe, they can break fairly easily too, right? So all of this here, I've pointed out the main thing to know. Why do blood vessels run through and near bones? So please don't memorize ostium, transverse canal, all of those things. But this is a good picture to show that this is a bone, so a piece of a long bone here. And it shows blood vessels running all up through it. So why do we need that? You don't tend to think, yes, oxygen. Yeah, we don't tend to think about our bones as being living tissue, do we? But they definitely do. So our bones, if they weighed as, so if we were made out of concrete skeleton, we'd weigh something like 400 kilograms or something. But our bones, for its size, is actually stronger than concrete. But one of the great things about it is that if we break it, it doesn't say broken forever. So if you break a piece of concrete, maybe you can weld it back together or something, but it's not going to heal itself. Our bones do heal themselves, and it's because we have live cells in there that will grow and regenerate new bone. So because we have all the living cells in our bones, all living cells have to have an oxygen and nutrient supply from our blood vessels. So the periosteum or stinum, you can see, has a lot of blood vessels run along the inside of that and through it too. So all of those little cells that are living in there have oxygen and nutrients so that they can grow and live. Yeah. Yes. Okay. So quiz. The tube-like part of a long bone, also known as the shaft, is called diaphysis. The spongy ending of a long bone is called epiphysis. So the end also starts with E, so maybe that will help you remember. I don't know. Epiphysis and the end of the bone, they both start with E, so maybe that's helpful in studying. I don't know. Bone marrow is found inside or outside? Inside of some bones. Why do bones need access to blood vessels? So they can regenerate because they're living cells and they need oxygen and nutrients. Yes, bones are living cells that need oxygen and nutrients brought by the blood to survive. So there are two kind of sections for a skeleton. So we have the axial skeleton. So what parts of it are made up of that? What do you see there is the axial skeleton. So that's the blue part. If you can't read microscopic writing here at the bottom of the slide, guys, can't you read this? Like, what's wrong? So the blue pieces are axial, and all of the bone-colored pieces is the appendicular skeleton. So the axial is the middle part. So what do you see as part of the axial skeleton? Cranium, yes. Ribs. I heard ribs.
The bottom of the spine.
Yes, all the way down the spine to the, what is this called? Coccyx and sacrum. Sacrum, coccyx, so the tailbone down here. Yeah. The ribs, I heard, neck, head. So all this centerpiece. You could think of core, but there's some things in your core that you might not. The spine is part of your axial one, yes. Axial. Axial. So what's mainly happening in the axial skeleton?
The inner organs that are life-threatening. You're surrounded by the outer moving parts.
Yeah, so in your axial skeleton, that's where you're finding most of your internal organs and things. So a lot of it has to do with protection and support. Because in your axial skeleton, you're going to find your brain up here, your eyes.
I can't see far, but I can see.
Your axial skeleton is where you're going to find a lot of your organs. So a lot of it is designed for support and protection.
So your inner organs are protected by
Yeah, so in here you have your lungs, your heart, all is going to be within your axial skeleton. What is? I'm on axial though, so just remember people are learning about axial. So you're going to have your lungs, your heart, your intestines, kidneys, uterus, bladder, all of that stuff, brain, eyes, all of that stuff is going to be found in your axial skeleton. And a lot of the bones around it are designed just to protect it. Okay? So appendicular are all the bone-colored ones. So what things do you see there?
long bones.
There's a lot of long bones. What do you think the main purpose of the appendicular skeleton is? Balance. Support, I heard. Bearing weight, yes. Movement, that is the big one. So a lot of your appendicular skeleton purpose involves movement. So your arms, your legs, your pelvis, your feet, your hands, and actually your shoulder blades and your clavicle. So your shoulder blades and your clavicle, that's where it connects. So your axial skeleton here, your appendicular, so up here it's connected by your shoulder blades, your scapula, and your clavicle. So that's where those two connect. And at the bottom, your pelvis is part of your appendicular, and it connects to your coccyx here.
What a good way to remember is appendages.
appendages and appendicular. That might be a good way to remember if it works. Yeah. Okay. So movement is a primary function there. And support and balance, those things that you require. What? The arms and stuff? Axial's the middle, yeah. And then appendicular is like the arms, the legs, the pelvis.
So if we were documenting something, if you had like your store right here, can we say it's on his axial, whatever, axial?
So axial, I wouldn't, because your axial skeleton is all of this, right? You're better off saying midline of the chest wall or whatever. You have to be specific, right? When you're so because it's all of this. Axial skeleton visible, I wouldn't bother. Just say open wound on his chest wall, right? No. So appendicular, responsible for body movement, your upper extremities, your lower extremities, including your hips. And then your axial, skull, ribs, vertebrae, sacrum, coccyx. Skull, ribs, vertebrae, sacrum, coccyx. So just to know about your vertebrae, so we talked about this, and Peggy talked about this in body mechanics too in her presentation, that the vertebrae have 5 different regions. Okay, so cervical up here at the neck, thoracic here, so this piece that's kind of over where your lungs would be. Lumbar being the most injured, strongest but most injured part of your back. Yeah. Yeah. And then sacral is here. And those bones, those vertebrae are kind of fused together. They're not separated anymore down here. And then the coccyx is the tiny piece or the tailbone at the very end. Okay. And what kind of bones are these vertebrae? Irregular bones. Pretty much just because they don't fit into any other category, so someone had to make up a new one. So that kind of shows the nice natural curves that happens in our spinal column, and how bad posture can disrupt those. And some of the disorders we'll look at involve those curves. So there's this one at your neck, this natural one that goes around the thoracic area, your lumbar curve, your sacral curve. From the back, it should look straight up and down, but there is a disorder where that straight up and down is more side to side. Yeah, does anybody have experience with that? Scoliosis, you're right, yep. So what's kyphosis? It's having an exaggerated, yeah, so that's in another slide here actually. But from the back, a nice healthy spine should look straight up and down, and you should have these 4 nice curves here. So, does his spine look the same as that spine back there? Does he have 4 curves in his spine? No. How many does he have right now? 1. He probably has 2, because his head here, right? But a newborn doesn't even have that one. So when a baby first comes out, they're C-shaped when a newborn is first born. They don't have any of those curves. So why do you think they develop this one first? What can they do developmentally? Hold their head up. So that's one of the first things they're able to do developmentally, is hold their head up. So that's supporting his head, and by having that curve and those muscles develop there, he can now hold his head up. What's one of the next things he can do? Sit up on his own. So he'll keep kind of the curve here happening, but he'll develop this one as he's able to sit and stand. Those muscles will develop. That be more natural, you mean? Yeah. It still does, if they're strapped in right, it still does keep them in a straighter position than they're used to, and it could be why babies cry a lot when they're in car seats too, right? It's safer, and that's the reason for it, because they have to be strapped in like that. But and it's one reason why they say, like, don't put them in things before developmentally they're ready. So don't put them in a jolly jumper before they can safely hold their head up. So why would that be? Yeah, because those muscles aren't developed yet. So if they don't have the ability to hold their head up straight, then those muscles aren't developed. Their heads will flop around where they shouldn't be, right? But it's the same as some physiotherapists will say don't put them in jolly jumpers at all for a similar reason, because if they're not able to hold themselves up, then those muscles aren't developed yet, and so you're putting strain on back muscles and everything too. Or like exercisers, some will say not to put baby, like that they're bad altogether for that reason. I know, or they didn't have twins, right? Most people use them, but some, I'm not saying it's a bad thing or whatever, but some physiotherapists or occupational therapists will say they are for those reasons, because you're putting them in an upright position before their bodies are physically able to be up like that. The muscles aren't ready to be in that position yet. Okay. Yeah. Yep. It might not have been. It might not have been, yeah. Yeah. So here's an example of what some of those conditions look like. So normal curvature, and then scoliosis. If from the back, you would see this spine, they say like S-shaped, or it can even be more C-shaped or whatever. So it doesn't have this straight up and down. It's kind of going back side to side where it shouldn't. So that's scoliosis. Has anyone known anyone or had to wear like a brace for that or something? So that could be. Yeah, so sometimes as teenagers, they'll end up wearing braces to help correct it if they have that condition. Hmm. Yeah, because if you tilt this, it puts everything else out of line. And so if the curve is up in this part, you can imagine the shoulders are here. If that's curved that way, it would make your shoulders go the same direction, right? Or if you have a curve down here that's abnormal, it would tilt your hips in an abnormal way. So you can see how it's out of alignment. It could cause pain or just other things happening in your body, like breaking down certain joints. Your center of gravity is out of position, more prone to injury. He had an injury. Yeah, right. Yeah, it's hard if you have a spinal cord injury to keep it completely immobilized. Yeah, to give it a chance to heal. Hmm. Yeah. No. Sometimes, if you've ever seen a doctor get someone to bend over to check their hips, that's part of what they're checking for, because when you bend over, they can see that these two parts of your hip bone, if they're on an even level, then your spine is probably you know, fairly straight. If one's tilted up or down, then that's showing that you have an abnormal curve happening there. All kinds of joints can get out of whack with polio. So yes, it can happen. Yeah, it can happen in all of the joints though, but yeah, that's the most debilitating, or it can be, because it throws everything else off, right, in your spine. So kyphosis, so that's an abnormal curvature up here. And so you do see that a lot in elderly people. So as your muscles weaken, you tend to hunch a little more, or if you're worried about tripping, you may be reaching down like this a little bit, or exactly. So that's one assignment. It's actually 100% true, and not just in 20 years. They're seeing it right now. And especially young people using them all the time who are still developing all these bones and muscles and everything too, right? Thumbs too, yep. Getting like tendinitis and thumb joints and everything, yep. And then lordosis. So where might you see this happening? So that's a curve inward more here. When would you see something like that? Pregnant. Yes. It, so that has to do with your muscle. Yeah, that's funny. The one man in the room got pregnancy. Yep. That's exactly it, because if you have all of that weight of a baby in the front, something has to compensate and give in your spine. So so it can pull your spine out abnormally, and that's why a lot of women end up with lower back pain and can have more easily injured in your lumbar area when you're pregnant. It's out of your center of gravity, and it's not in its normal alignment. Okay. So there's just some pictures. So on an X-ray, you can see that this person has a almost S-shaped curve there for scoliosis. It can, yep, yep. 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 And then kyphosis, so that abnormal lump or out curve. Probably. You can stand up more than that, yeah. A younger person? Yeah, so if you can notice it, then it's kind of to a point that it's extreme, but some of us may even have the starts of a kyphosis from bad posture, right? So when we did that posture check and you had to lean up against or stand up against the wall with everything flat, like if it's hard for your head to be flat against the wall and your shoulders at the same time, you could have the start of something like that. And then lordosis with pregnancy is the most common reason to have that, or just carrying excess weight there. So don't memorize all of these. Don't do it. This just shows how many bones are actually in the skull. So if you think about your skull, you think about it kind of as one piece, right? Well, it's not. It's all of these different bones that are together, okay? And so that's one joint you'll find in our body. So it's easy to think of joints like our elbow and where we did like all the range of motion and our hips and our knees. But there are joints in our skull, but they're just not movable. So it's made up of many different flat bones, and on this skeleton you can see, and in a baby, you know how they have a soft spots in the top of their head. So those are just joints that haven't formed together yet. So all of those bones have joints between them, but they're just not movable joints. Okay, so why would a baby still need movable joints up there? Which part necessarily? The brain is still growing. That's very true. Yeah. Kind of. So that babies can get into trouble. So doctors are always checking soft spots on babies to make sure they're still open till a certain age. Because some babies, they'll close too soon, and then there's no room for their brain to grow. So sometimes they surgically have to go and make openings for the brain to have that room. And long term, the baby could end up with brain damage or, trouble with the skull because of that. So doctors are always checking. So one soft spot, there's two usually. One closes at around 3 months, and the other will close closer to 3 years. So all of that, it's given all of that time for the brain to grow and have room to grow. But all of us, none of our joints move. So people, if you have a brain injury and you have swelling on the brain, what is something you've heard of them doing? Drilling. And they're doing that to relieve pressure because there's no room for things to happen like that in there. So you're talking about the person with dwarfism that had to have brain surgery. Was it because of pressure on the brain? Yeah. So sometimes even if a brain gives off excess fluid or whatever, that can build up, and the pressure has to be relieved somewhere.
So what causes this to give off extra? Like alcoholism, like a lot of
So the brain and the spine has cerebral spinal fluid, and we'll talk about more of that in the next unit, but that fluid is around the brain and the spine, and it's made in the brain. So if it's not draining the way it's supposed to be, so some people get like shunts put in to drain it off, or if it's not draining properly, or if it's making too much of it, it will build pressure in the head.
I see a little one, first time I've seen it here, and I got just shocked. A little one, the head the size of a basketball, other one, with a shut in the back, and his eyes were sunset. If you were a sunset, but they aren't short.
And that would be because that fluid is not draining properly, so it causes too much pressure that happen in there. And if it happens but while you still have those joints open, then it can actually make the skull get bigger too.
How come the teeth aren't on there?
I don't know why they're not labeled as bones. I think it's just looking at the skull.
Oh, okay.
They all have their own names too. Don't memorize those either. Okay. So the thorax, so that's the name for this piece that you kind of think of being around your ribs. So there are flat bones too, your clavicle and your rib bones, flat bones. The sternum also is this piece in the middle that connects in the middle. No, just no ribs. Clavicle is good to know up here. Okay.
Clavicle, is that your collarbone?
Collarbone, yep. And the sternum is this piece in the middle that kind of is a connecting point for all of your ribs to come. And that is a really tough, hard bone, and it's located more so protect to like your heart and things that are directly behind there. And your heart's slightly to the left too, but okay. And some ribs aren't attached to the sternum, so in the back these floating ribs here. If you don't have a lot of cushioning, I have too much cushioning, but you can feel the floating ribs and where they end too in some people. Okay.
Your ribs can grow back.
So they can heal. If you like removed it right from here, it wouldn't build a new one. Okay. What's that? So, okay. Oh, just a second here. Did I miss something back here? Oh, and on here it shows like this a little shinier here, so it's not hard bone right up until there, so it's cartilage that connects as well there, okay? That's part of it. Your collarbone, your clavicle. Clavicle. So that's your collarbone, okay? Yes. If you're breaking a rib, you're talking about? Yeah. Yeah, no, it's a little more flexible because you do have to, like, you breathe, and doing CPR on somebody, if they're elderly, you will break ribs, but on a younger person, you won't break ribs generally because it's flexible and made of cartilage partly. Okay. Yes, you can. Yeah. Yeah. And then when you break a rib from coughing, then you can't cough anymore, then you get pneumonia. Like, it's very, very common. You'll see that happen in your clients. To support it. Yeah, because you can cast an arm. If you break this bone, you can put a cast on to support it, and then it keeps it from moving too much. You can't put a cast on. That's why if you break a rib and go to the doctor, they're like, is it puncturing their lung? Nope. So good luck with that. Yeah. So that's support. So that's why some people might put a pillow there, or something that might feel better to support it, but nothing is going to keep it from moving. So again, don't remember all of these, but ulna and radius and humerus. So humerus is this big long bone up here. And so in your worksheet, I gave you a skeleton to mark these ones that I'd like for you to be familiar with. So in here is what you think of as a funny bone. And it's not a bone, actually, but a nerve runs close to the surface of the skin in your elbow. And that's why if you hit it, it causes pain or numbness or whatever. So it's not actually a bone, though. It's a nerve that runs in there. So the radius is on the side with your thumb. So radius is on the side with your thumb. And the reason I feel like these ones are important is when I'm teaching you to check a pulse, the radial pulse is along that bone. So that bone here, when you check your pulse, is next to there. So that's why these bones are important. Yep. So radius and ulna is this other guy down here. So you don't need to know any of these other pieces here. Well, it is the other guy or girl down here is the ulna, okay? Humerus is this long one up here on the top of the arm. So this long guy up here. So same thing, it's just showing the other arm. If we looked at the other arm, it's the same, only just know the radial bone is on the thumb side. It's same on the other arm. It doesn't switch because it's the other arm. So again, you don't need to know all of these. Don't memorize all of these. But you do need to know finger bones are long bones. Short bones are here in the wrist. These smaller cube-shaped ones here are short bones. And this does kind of show where the radius and ulna connect to the wrist too. Okay. Do you guys need to have a break? Go have a break. Yes, go stretch everything. There. Oh, phew. Good. Thank you. I'm not singing on YouTube now. So bone, you don't again, like don't memorize all of these, but long bones, short bones, ankle bone, that's where you find the short bones, right? All these cube-shaped guys in here. Okay. So arches of your feet, just to your clients, you might have to give different supports in their shoes or whatnot. And generally, those supports have to do with arches or problems with arches. So normally we have an arch here on the inside lower part of our foot, but some people don't. So some people have lost those supportive kind of structures in the bones and ligaments in their feet, and it's flat on the ground. Does anyone have flat feet? Yeah, like if you make a footprint, you see the entire foot. Not in sand, like you might see the hole in sand, but if you like ink stamped your foot and you see the entire foot, then you. So do you have pain or problems with your flat feet? Is it still the case? So orthotics, do you wear orthotics to help correct? Yeah. So you can. You're gelling? Yeah. So you might be helping your clients like to with their inserts in their shoes or something. So it's good to be aware of that when you're caring for people. Okay. So again, don't memorize all these things. It throws other things out of alignment. Yes. What are you looking at? In what? It's just so that would be tilted to the wrong side. So you don't have to memorize those things necessarily, but know that if you have problems with arches in your feet, your clients might need supports and stuff. And same for you guys are going to be on your feet all the time. So if you have problems with your feet, make sure it's taken care of well. I don't know. Oh, like clubbed foot? Okay, so that's something different. Yeah, so that's usually like a genetic thing that can happen where your feet will turn the wrong way. Some you might. It can be hereditary. Yeah, having. No, it's weaknesses in the support structure of your feet that causes it to drop. Genetically, that's how your feet might be.
Yes, yeah. A friend of mine, she had a son.
Yeah.
And when he was born, he had
Club feet.
And he had to go have like he was like a couple weeks old, and he had to have his feet operated on, and he learned to walk, but with cast on his feet because he had to have serious.
Yes. Yeah. Yeah.
And they said it was from how he was positioned. Some of it was how he was positioned in the movie.
Yep. Cause tightening in ligaments.
Glands and whatever, and I don't know maybe pressure.
Mhm.
He learned to walk.
Yep. So a lot of it has to do, so even when you're talking about clubbed feet and whatever, a lot of it has to do with the ligaments and the structures that are supporting around the bone. So either they get damaged or genetics, like some of you said, or like club feet, some ligaments can be too tight and pull bones where they shouldn't be. And that, so some people end up with surgery and yes, yeah. Or wearing braces. Did it work? It did. Yep. Oh, there you go. Yep. Okay. So there can be, just for fun, so there can be some differences, especially between men and women. So a male skeleton is generally larger and weighs a bit more. So a difference in the shape of the pelvis, you can imagine why. Exactly. So there's a picture there. So the pelvic inlet is what you think of this opening here. So for women, generally, like physiologically, it needs to be large enough for an infant's head to fit through, right? Men don't have that same need, so their pelvises are generally a bit more narrow. And this opening, this outlet here is um, not shaped the same. So in women, it's a little bit rounder. In men, it might be more narrow. Okay, so this next picture kind of shows that. So when it's talking about a pubic angle, so this angle down here is generally wider in women. And so that's just because it makes this opening more round so that a head can fit there through there. So an infant's head can fit through. And it shows the pelvic outlet more round in a woman's pelvis and more kind of egg-shaped almost for a man's. But don't memorize all of those things, okay? It's just really hard to find pictures of stuff where they don't have them all labeled. So age differences. So your skeleton is pretty much the way it's going to be by the time you're about 25. Before that, some of the bone might not be completely hardened into bone. You may have more cartilage in different parts of your body. So when a baby is first born, a lot of their bones aren't hard formed bones. They're still growing, so there's going to be more cartilage there instead of bone. But by the time you're 25, you pretty much have what you're going to have. And then after 50, the density of your bones can decrease some. So there's a condition when that becomes, so naturally that happens. If it gets to be too much, it's osteoporosis, yes. So this is often why they're saying that, get your calcium when you're young, because that's when things are still forming, when you're going to get your bone density. And they're thinking after that point in time, adding extra calcium might not make much difference as far as when you're older and osteoporosis goes.
With the other osteoporosis, it's good to keep active because the bones build up.
Yes, and part of that, yep. And keeping the muscle strong around the bone is very important because that's what's supporting it and protecting it too. But getting enough calcium, and why do you need vitamin D? Why does it say calcium? Why do you always see that together, calcium and vitamin D? It has to do with absorption. Yeah. So one of your groups might be talking about that in nutrition class tomorrow. How our body absorbs vitamins and how some vitamins need other things to absorb. That's why, have you ever heard of someone tell you that your cooked vegetables need butter? Yeah. So there's something to that in that some vitamins that are present in vegetables need fats to help absorb them. So by adding butter to your vegetables, it's giving it a fat that will help you absorb vitamins. So that's the excuse I use for putting butter on everything. I need it for my vitamins. I need it for my vitamins. And then exercise has an effect on the skeleton. So good exercise can help support the muscles that support the bones and can help keep things moving. Have you ever had shin splints from walking too much? Or from running, if you're a runner, from running? So those are like microscopic little fractures along this bone in your leg. So you can definitely overdo it. And it bears a huge amount of weight. Yeah. So you can do that. And it's also along the same principles. They say some hip fractures may have happened before someone even fell. So they're saying like someone falls and they've broken their hip. Sometimes they're thinking that maybe that happened and it caused them to fall. And that could be because the muscles aren't supporting it anymore, the muscles are weaker, the bone density is a lot less, and so just by walking or doing something strenuous, it caused that bone to break or that hip bone to break.
Now, and I have another question about the pelvis. When a woman has a child with pelvis bone,
This little ligament right here, it can move some, so it softens some with pregnancy hormones, and so it gives some movability there. And also back here, this joint is not completely immobile. So that's why even somebody that you would think like, wow, they're very tiny, how could they ever give birth to a 10-pound baby? Well, those are part of the reasons. Even if their pelvis seems small on the outside, this is movable. These joints here are movable. No, men have this too. Yeah. Yeah. So because of those things, even if someone looks tiny on the outside, this outlet might be just the same as everybody else. And these things move and become more movable with pregnancy hormones too. Yeah, so it doesn't really open. So there is a disorder that can happen. Have you ever heard of someone being on bed rest because of their pelvis or pain in their pelvis? This can separate. Yeah, so this can separate by accident or by injury.
oh, it's like when you hit your crotch on your bike.
Not quite, but that's painful too, yes. Yeah, so some people can end up on bed rest because of that, because it's really painful, right? But even just having like pelvic pain, that's often where it's coming from too, because this stretches some and things are moving that don't normally move. Pelvic pain. Yeah. Okay. Sometimes, yes. And that pain that's down low and it feels like it's in your pelvis, it's often that spot there that is hurting in pregnancy. Well, now you know what it was the cause of it. Yes. So the last piece for this one, and then we'll kind of do muscles tomorrow, so just joints. There are all kinds of different joints. We're just going to talk about the three most common. There are some different ones, like this one in your jaw is a different kind that we won't really get into. And what are some other ones? Oh, like in between the vertebrae is a different kind of joint. So, but the three main ones are here, and I'll talk about them more. So a joint is basically just the point where two or more bones meet. So wherever bones are connected to one another is a joint. Okay. So another name for it is articulation. So if in your book you see it's articulations, that's talking about joints.
Is that another word for joints?
Yes, it is. Yes. So joints are where bones get held together and allows for flexible movement. So if this arm were just one long bone to your hand, you'd have less movement. Okay, and if you've ever wore a whole arm cast or whole leg cast, you know how difficult that would be to do things for yourself and to get around.
How do you say that word?
So the hyoid. So that bone is actually up here, and it's the only bone in your body that doesn't connect to another bone, and it's here in your neck, and your tongue kind of connects. It's a support structure for your tongue. The hyoid bone. So in here, there's like this free-floating kind of, not free-floating, it's connected by tendons and things.
It's just like where I can't move it.
That could be more this joint up here,
Well, I have to
actually.
It's kind of like goes like a frog.
Oh.
And sometimes I move like that too.
I don't know.
That's potential. Well, it could be.
It could be the hyoid bone there,
My
maybe.
kids all have jaw problems.
Yeah. And generally jaw problems come in that joint up here in the bone in the body, but that could be something else happening down there, I don't know. So So all other bones connect to at least one other bone. And there's that hyoid bone just up here. And it's a structure that supports the tongue, where the tongue connects. It's the only one that doesn't connect to another bone. So I already talked about some joints that don't move. So all these joints in the skull don't move, thankfully for us. And then there are some with slight movement. So this one that we just talked about with pregnancy, this joint right here where the two pieces of the pelvis connect, it has slight movement, more so in pregnancy. Yeah, in later pregnancy. So some have no movement, some have slight movement, but the main ones are the ones that have lots of movement. So there's just examples. So the free moving joints, so another word for that is synovial joints. And synovial because on the inside it has synovial membrane that has fluid inside of it. So again, these synovial joints have the cartilage. So we already talked about that as being that kind of protective coating on the end of the bone. Okay. So it has a cartilage, a synovial membrane. So that's a membrane that it covers the fluid-filled pouch on the inside. Okay, so that's a bursa on the inside. The synovial membrane lines the joint, and it gives off fluid on the inside. So all your joints have this kind of, or all these synovial joints have this pouch of fluid on the inside that acts to shock absorb and protect both ends of the bones from rubbing against one another. It can, no. It does cause the joints to move in a way that it's not a natural thing. Like it's. So this. So has anyone had bursitis? So bursa is that fluid-filled pouch in between these synovial joints, and bursitis is an inflammation of that fluid-filled pouch. Very painful. So the joints could feel warm, they could be very swollen and red. Mm-hmm. Could be arthritis too. Bursitis, you can. This joint right here is a common place to get bursitis. Yeah. Yep. The discs. Like the cartilage or the. Yeah. So if we didn't have these synovial membranes and this bursa in between these joints, these bones rub next to each other and it causes a lot of pain because there are nerves that run through there. So when you're pinching those nerves off, it's really painful. So that is just another name for synovial, free moving, so don't worry too much about that. But so this just kind of shows the joint cavity in there, the cartilage on the end of the bone, the membrane which encapsulates all of this on the inside. It shows the picture. So the three major types that we'll worry about, so ball and socket joint, hinge joint, and pivot joint. So where's an example of ball and socket, do you figure? Shoulder and hip. Yes, those are the two main ones in the human body, shoulder and hip. And they allow movement in all directions around because the bone is kind of like ball shaped up at the top where it connects. And so it allows movement in all kinds of different directions, back, forward, out. So we can abduct and adduct. We can do all of those things with these joints. Mm-hmm. Yep. Yep. They check that. Every baby gets checked for it. Yep. Ah, because they were so tucked up. Mm-hmm. So down here in the hip, you can see it. It looks kind of like a ball and socket. This top part of the bone looks like a ball, and it fits into that socket there, and it moves in all directions. Okay. Hinge joint. So hinge joint allows movement in one direction. So what do you think a example of that might be? The elbow. So the elbow does this. So if you think of the hinge of a door, it's the same principle. So that's the funny bone, but it's not a bone, but it's that nerve that runs. It runs very close to the surface here between the ends of the bones. So hinge joint, think of the hinge of a door and how it goes in one direction like this. Your knee, no, the jaw is a different kind of joint we won't worry about. Yeah. The knee is another hinge joint. No, but you can do different things on that one. So that is a pivot joint. So hinge joint here. So it goes in one direction. Okay. And then the pivot joint allows turning from side to side. Yes, the neck. So this bone in here underneath the skull allows you to do this. So there's lots of different joints there actually. You can do this. There's some pivot joints in there. There's a different kind of joint that we won't worry about in there. There's different things in there. So we're not going to worry about the other ones. In fact, this one has its own name, one of these joints. There's a pivot joint in here because you can do this. So there's all kinds of different joints in your wrist, so we won't worry about those ones necessarily. And the jaw is another one that has its own feel. It has its own name. So ball and socket, hinge, and pivot joints. Those are the three we will worry about. Okay. These are some of the other ones you guys are talking about. So gliding joint, saddle joint. See, look, he has the carpometacarpal joint of thumb. So there's one there, right? So don't worry about those ones, okay? But the hinge joint, the pivot joint, and the ball and socket we will do. But if you're interested in the other type, you can give examples here, all right? All right, so that is good.